All right, so fraud warning number 3, diagnosis. It's important that you understand this idea of diagnosis pointing. So, we just opened up the HCFA form to be able to allow more than 4 diagnoses, but just as an example, and to keep this simple, I'm going to just say there's 4 diagnoses. And let's say this is a pain diagnosis, this is a muscle spasm diagnosis, let's say that this is a nerve diagnosis, and this is a syndrome diagnosis. Okay, so it's important that you not only have enough diagnoses so that as you go through the treatment plan, these knock off. I personally like to keep them in order so that as we start to treat the patient, we can knock off the different diagnoses as the patient gets better. So in the beginning, yes, pain should go away first, so that one will come off after maybe the first re-exam. Maybe even muscle spasms would come off. So the point is that these diagnoses, now that we can have more than 4, you would make sure that as you move through the treatment plan, that the diagnoses that are now being corrected are removed from the HCFA. They don't all stay on there for that treatment plan. I mean, I have seen doctors who keep the same diagnosis for the same patient year after year after year. That's definitely not going to pass an audit. But the point here I'm trying to make is that even if you stop doing that and you did it for every treatment plan, that's still not enough. You need to make sure that you take off the diagnoses as soon as a re-exam happens that have been corrected. And the next thing you have to do is when you're doing procedure codes, like let's say you're doing traction, and let's say that you're also doing massage. Well, which diagnoses actually go for that? You wouldn't, most doctors just put 1, 2, 3, 4 for everything. 1, 2, 3, 4. Well, that's not really giving you a differentiation of why you're doing these 2 services. So of course, the insurance company is going to say, oh, we don't need that muscle therapy. We're just going to take that one off. Okay, so we can take that one off because it's the same thing. We're only going to pay for one of these. So what you need to make sure is that you do differentiate why you're doing the different services like muscle stim here. Maybe that's for 3 and 4, and maybe this is for 1 and 2. That's what we call diagnosis pointing. Now, I'm not saying that this is exactly correct. I'm just trying to make sure you understand the idea that each diagnosis doesn't have to match up with every single one of your treatments that you're doing, that you could differentiate the treatment and the different diagnoses and separate them out. And if you do that, it makes sense to the insurance companies, and you have a more likelihood of not only getting paid for the services you do, but if you do go through an audit, getting to keep that money.